All right, today we're jumping into a real workhorse of the emergency room, hydrocortisone. It is an incredibly powerful drug, but like any powerful tool, you've really got to know how to use it because it is absolutely a double-edged sword. I mean, think about it for a second. How can one single medication be used for something like swelling in the brain, but also for a bad asthma attack and even for someone in septic shock? It almost sounds like it does too much to be true. But that's exactly what makes it so fascinating and so critical to understand. So, to answer that question, we've got to get back to basics. What exactly is this stuff? Well, the easiest way to think about it is this. Hydrocortisone is like the body's emergency brakes. Let's dig into how that works. At its heart, hydrocortisone is a corticosteroid. Now, that sounds like a complicated word, but the concept is actually pretty simple. Corticosteroids do two main things. They slam the brakes on inflammation, and they tell the immune system to just take it down a notch. So when your body is freaking out, whether it's brain swelling or your airways clamping down, this drug steps in and says, everybody just calm down. But that's not its only trick. It also has something called mineral corticoid actions. I know, it's a mouthful, but all it really means is that it sends a message to the kidneys saying, hey, hold on to salt. And as you know, wherever salt goes, water is sure to follow. Now, this little detail is going to be incredibly important, as we'll see in just a minute. And this brings us to one of the most important warnings you'll ever hear about this. The names solucortifef and solumedrol sound almost identical, right? Well, they're not. They are not the same thing. Solumedrol is another corticosteroid, but it doesn't have that strong salt and water retaining effect. Mixing these two up is a huge deal and can have really serious consequences. So here's the bottom line. Solucortifef is hydrocortisone, the one that makes you hold on to water. So how fast does it work? Well, it's not like flipping a light switch. After you give it, it takes about 1 to 2 hours to really get going. But here's the trade-off. Once it kicks in, it keeps working for a long time. We're talking more than 24 hours of that anti-inflammatory support. So now that we've got a handle on what it is and how it works, let's get to the fun part. Where does this drug really shine? Because in the high-stakes world of emergency medicine, this stuff can be a total game changer in a few really specific situations. And here they are. Just look at the sheer range we were talking about. On one side, you have these massive inflammatory problems, like cerebral edema, that's brain swelling, or a crazy asthma attack that isn't responding to anything else. But then, on the other end of the spectrum, you've got hormonal emergencies, like thyroid storm, or, and this is a big one, adrenal insufficiency. The septic shock use is still a bit debated, trying to balance its benefits with suppressing the immune system, but it's definitely in the toolbox. But let's just pause on this one for a second, because when it comes to adrenal insufficiency, hydrocortisone goes from being a helpful tool to being an absolutely 100% essential life-saving medicine. This is a condition where the body literally can't make its own corticosteroids. So in that case, you're not just treating a symptom. You are replacing a vital hormone the body needs just to survive. Okay, so we've seen the power, we've seen what it can do. But remember we called it a double-edged sword? Well, now we have to talk about that other edge. Because with a drug this potent, you have to understand the very real risks that come along with it. There are a few major red flags, situations where you've got to be extremely careful. Why? Well, think about it. Steroids can be tough on the stomach, so they can make a GI bleed worse. They can also raise your blood sugar, which is a big problem if you have diabetes. And maybe the biggest one. Because they turn down the immune system, giving them to someone with a serious infection that isn't being treated yet could be a disaster. And a list of potential side effects makes perfect sense when you remember how the drug works. Remember how it makes you hold on to salt and water? Well, that can lead to high blood pressure or hypertension. It's a powerful hormone, so it can mess with your mood, causing anything from depression to psychosis. It can keep you up at night, spike your blood sugar. You get the idea. These aren't small things. They are serious effects from a very serious drug. All right, let's dive into some of the fine print. Because no drug works in a vacuum, right? Hydrocortisone is no exception. It can interact with other medications, and there are special cases where you have to be extra thoughtful. So here's a great little summary. If someone's taking insulin for diabetes, hydrocortisone can basically work against it by raising their blood sugar. Or if they're on another drug that lowers their potassium levels, like some water pills, hydrocortisone can make that problem even worse. And dangerously low potassium is no joke. Now, what about pregnancy? This is a really interesting one. While doctors are cautious with a lot of drugs during pregnancy, for a patient who has adrenal insufficiency, hydrocortisone isn't just an option. It's actually the preferred choice.
This is such a critical exception that helps keep both mom and baby safe. And that leads to a really smart strategy. Labor is, well, incredibly stressful for the body. Normally, your body would pump out extra steroids on its own to handle that stress. But if you can't, it's a huge problem. So, doctors will give what they call stress doses, basically higher amounts of hydrocortisone to prevent a life-threatening crisis during delivery.
Whew. Okay, we have covered a ton of ground, so let's just boil this all down. If you're going to walk away remembering just 3 things about hydrocortisone, these are the ones. Here we go. Number 1, it's potent, but it's risky. It is a beast of an anti-inflammatory, and it demands your respect. Number 2, it is absolutely critical for adrenal insufficiency. There, it's not just a treatment, it's a life-saving replacement. And number 3, it is not Solumedrol. Please always remember the difference. Solucortef, that's our hydrocortisone, is the one that makes you retain salt and water. And that really leaves us with a much bigger question, doesn't it? A drug like hydrocortisone is the perfect example of the tightrope walk that happens in medicine every day. It can literally save a life in one situation and cause serious problems in another. So the real question is, how do we keep getting better at balancing that immense power with a very real potential for harm?